The Omicron variant has now spread to more than a dozen countries and territories. Scientists are racing to find answers about the strain. Here's what we know so far. Well, early evidence suggests Omicron is highly contagious, possibly more than Delta. The first image of this new variant shows more than 30 spike protein mutations. Delta has 18 of them. The spike protein is the part of the virus that binds to a human cell, infecting it. Now, simply put, more spike protein mutations suggests more transmissibility and potentially more mechanisms to evade immunity by vaccines or even prior infection. But that doesn't necessarily mean that it's more dangerous. So far, cases have appeared primarily in young people. According to one of the first doctors who detected this strain, the symptoms are typically mild. She says that most of her patients experienced headache, itchy throat, fatigue, as well as body ache. Mostly symptoms that can be treated at home. Then there is the question of how effective vaccines are against this variant. Theoretically, Omicron has mutations that could potentially make vaccines less effective and raise the risk of reinfection. But limited data means it's still too early to make conclusions.
The whole hype out there doesn't make any sense, medical sense at this stage. We can't even say at this stage that the vaccine is escaping, the virus is escaping vaccine immunity. We can't even say that at this stage, because so far it fits in with what the scientists told us what's going to happen. So when it's fully escaped the vaccine immunity, I think that's when you will really see sick people, but not now. We're not there yet.
Scientists say that if Omicron combines faster with some ability to evade immunity, then it has the potential to circulate as quickly as Delta. All measures can do is buy time for science and those boosters. Dr. Annelies Wilder-Smith from the Lee Kong Chen School of Medicine at Nanyang Technological University joins us live now from Geneva for more on this. Dr. Wilder-Smith, the WHO sounding the alarm that the risk from the rapid spread of this new variant is very high. How concerned should we be about that message?
So indeed, it was declared a variant of concern because of the many mutations, more mutations than we've ever seen for any other variant of concern. However, at this stage, we do not know what the real public health implications are. It may be more transmissible, but it may not be more virulent. So we have to wait for at least a week or 2 or 3 to really know whether the change in the spike proteins does translate into much higher transmissibility and or also more virulence. If we are lucky, it could even translate in less virulence.
Oh, Annelies, I'll pick up on that point you've made. As of now, we do not know enough. As you say, these mutations on the spike protein may actually work to make this new variant even less transmissible. But based on what we know from previous variants, is there anything we can read into spike protein mutations on Omicron being almost double the number that we've seen in Delta?
So the 3 concerns are that because of the many changes, there's now an immune escaping mechanism, which has 3 consequences. One, that if you had a natural infection that was closer to the original strain, you may now not be protected against reinfection with Omicron. The second is that the vaccines may now have a reduced vaccine effectiveness. And the third is that also monoclonal antibodies that were developed may now not work as well as they did before. What we do not know is the degree now of the immune escape mechanism, and that needs to be awaited for. And I can tell you that all the vaccine developers are now studying this new variant in the lab to show whether there is now a reduced neutralizing activity.
There is certainly so much more that we need to discover about this new variant, but let's talk about where the world is with inoculations, because we know that just over half of the world's population is fully vaccinated, just about 55% of us. How is that going to affect global COVID inoculation efforts?
So it's very important to reiterate, to restate that vaccine, even with a new variant, still provides protection. There may be some lowering of the vaccine effectiveness, but there is still protection, and there's protection that is even stronger against severe disease. And that's what we want to see. Vaccines still work, even against the Delta, and we will see now also with the Omicron, it works well against protecting against severe disease, but we see more milder breakthrough infections. So the message is we need to continue increasing global vaccine coverage rates for several reasons. One is to prevent deaths and hospitalizations, protect healthcare systems. But the second, also to prevent the emergence of more and more of these variants of concerns. The less virus is circulating worldwide, the lower the probabilities for the emergence of new variants.
Oh, Annelies, as you mentioned earlier, we will need to wait quite a few weeks before we know enough to take effective measures. But in the meantime, countries, you can imagine, are not taking any chances. Do you think at this point they have reacted too quickly in closing borders before the science is out?
It's a very difficult judgment call, and I am not envious of these governments who have to make very difficult decisions that are economically damaging. I think, countries are afraid that this could be, escape the vaccine, be set back to the vaccine impact. And they don't want to wait for the evidence and react early. And then maybe loosen up when they find out that maybe this variant does not have the negative impact. We also need to state that WHO has not made a recommendation for travel bans and travel restrictions. We need to continue, of course, testing and screening.
Certainly, vigilance is going to be necessary as we go on with this. Dr. Wilder-Smith, thank you very much for that. Dr. Annelies Wilder-Smith from the Li Kong Chen School of Medicine at Nanyang Technological University.